accident and emergency, you see some strange sights. Weird accidents.
I've never seen a case like this before and don't expect to see one ever again.
Freak symptoms. Abnormal injuries. Unflappable staff take them all in their stride.
Sharp scratch coming now.
Our cameras have spent 5 months in A&E at the Norfolk and Norwich University Hospital, waiting for the truly remarkable casualties. The odd and unusual cases you'd never normally see.
I got a needle and then stitched him up.
You did the stitching yourself?
From extraordinary surgery...
This is not just a simple crack of the bone, it's more of a bone explosion.
...to the most patient patients.
Oh, bloody hell, it does sting a lot!
These cases are jaw-dropping.
I've never seen anything quite like this.
Sometimes silly.
Ended up shooting myself in the foot.
And always bizarre. Coming up, hip horror when a 94-year-old pensioner is slain by a 6-legged insect.
It was a big one. For some reason I tried to kill it. I wouldn't hurt an animal, but I just hurt that one.
Emergency surgery to try to save fingers lacerated by a lawnmower.
X-ray. Wow, nice.
An extraordinary hair-raising accident.
It got my hair at the back and just... Well, that was it.
And how surgeons saved the victim's scalp. Our first patient tonight has his elbow on the reception desk. But it's not a case of bad manners. Shane Burrows has something dangling from his forearm, which takes body piercing to new depths. Butcher Shane was hanging up a cut of meat on a rack. But the extra chop caused the rack to topple. Though Shane escaped concussion from the carcasses, one of the hams hammered a hanging device into his forearm, leaving Shane painfully hooked.
I think that was about 12 to 15 kilos that landed on my arm, which was attached to this.
The butcher's now hoping that the A&E team will save his bacon.
Well, that's a good one. Let me down. Well, I've not seen that before. I've seen variations on the theme before. Bear with me. I'll save your life in a minute, all right?
The stunned medic is not the only one at something of a loss for words.
Feels like just weird.
But the doctor can't let his patient off the hook immediately. As he explains, it's just as well Shane didn't whip it out himself.
If he'd have penetrated an artery, it might be that the pressure of the hook still in his arm would be preventing serious bleeding. If he pulled it out and started a bad hemorrhage, he might not be able to control it. Right, OK. Any numbness or pins and needles in your arm?
Yeah.
You have?
Yeah.
Where do you feel it? Where do you not feel it?
Where do I not feel it?
Yeah, where are you feeling it odd?
Odd, all the way up this side and up to these 3 fingers, really.
The 3 fingers.
Before he does anything, Dr. Walters needs to check for any obvious signs of damage. Shane's numbness could be a sign of knackered nerves.
Don't worry, I won't feel the pain. Just checking for the perspiration, because you've got perspiration and the nerves are intact.
But unlike the proverbial pig, our butcher doesn't seem to be sweating much. There's a danger that the hook may have hit the crucial ulnar nerve, which serves this part of the arm, and it's difficult for Dr. Walters to be certain.
I think it's slid down the tail end of the biceps muscle, not far from the tendon. You always have to remember you don't quite know where that thing has been before it sort of sprung back into its final position, so it might have caught the nerve.
The tension is enough to make anyone break out in a sweat, and happily, it looks like Shane is now doing so.
I think he's perspiring, but I'll be more confident when he's warmed up a bit.
To get the hook out, Dr. Walters first needs to make another hole in Shane's arm.
Ready? OK, right, sharp scratch, down we go. I've numbed the skin around it so that he doesn't feel as much pain as I think he would if I didn't numb it, and hopefully it'll just slide out.
Dr. Walters still can't be sure that Shane hasn't hit an artery, so removing the hook could be like uncorking a bottle of bloody bubbly.
How's that feel?
All right.
OK. All right, here goes. Grit your teeth. Easy in, easy out. Thank goodness that wasn't a large fish hook.
There's no arterial bleed, but Dr. Walters still needs to make one final check.
How does that feel? Your fingers feel fine now?
Yeah.
No nerve damage then, just one slightly manky bit of metal.
I think we should dispose of that because that end's been in you, and no disrespect, but there's always a slim chance of funny infections being transmitted, so I'm going to get rid of it. At the end of the day, I think it missed just about everything vital.
Yes.
All right then, young man.
Yep.
Look after yourself and change that coat. It looks disgraceful.
With Dr. Walters' fashion advice ringing in his ears, Shane is nonetheless much happier. Now he's off the hook.
Relieved. Arm's fitting a lot better than what it was before. Glad it's out.
Now, Norwich A&E sees its fair share of animal-induced injuries. But 94-year-old Olive Robinson has done herself a mischief after undertaking a mission of murderous intent. Olive has hospitalised herself, slaying a wasp. So what does our pulverising pensioner make of this Pyrrhic victory?
It was a big one, and I thought you'd get inside the bungalow, you see, so that's the reason I tried to kill it. Well, I don't dislike animals, but I haven't got any animals. I wouldn't hurt an animal, but I did hurt that one. It hurt me too.
Olive had been enjoying an afternoon in the garden when she spotted a massive wasp. Fearful it would attempt to enter her bungalow, she armed herself with a plastic milk bottle and undertook assignment insect extermination. Embarking on a perilous chase, and after a 5-minute frenzied battle, this unlikely assailant squashed the beast. But the killer blow was delivered with so much gusto, Olive slipped and crashed down on her hip.
She's not frightened of bumblebees or anything like that at all, but I don't think Mum gets a bad reaction, does she?
We're not aware of it.
No. Well, she didn't give it a chance, did she?
It's time for Dr. Oz to check out our heroic huntress.
And I can see that your leg is a bit shorter than the other one, and a bit rotated, external rotated. Can you move the good leg?
Yeah.
Okay, so this one is fine. I think you probably did something to your leg. Yeah. You probably fractured your hip. Just going to check the X-ray.
Yeah.
Okay.
So Oz sends the insect annihilator off to radiography. Having put on a brave face for the camera, Olive gets wheeled back and waits for the results of the X-ray. But it's not good news. The wasp, it seems, had one last sting in its tail, because Olive's fall has left her with a rather impressive fracture.
Well, I looked at the X-ray. You fractured the neck of femur, we call it. This sort of fracture does require an operation.
Thankfully, it's not all bad news, and Dr. Oz gives Olive some sound advice.
You can really walk as long as you stay away from wasps.
In true fighting spirit, she still manages to see the funny side. But any surgery at Olive's age comes with high risks. Does nothing deter this demon destroyer?
You need to calm down. It wasn't a very good idea chasing wasps. Let's hope that she doesn't do the other hip.
After a successful operation, our creepy crawly killer is on the road to recovery.
I don't remember a thing until I woke up in the ward. I don't remember anything really at all.
So what's next for the bionic granny?
No, no more wasps. And that's the wasp I'll remember for my life.
Horror injuries from all types of home improvement are dealt with on a daily basis at Norwich A&E. But bizarre terrors can lurk within the garden too, as our next case proves. Now, you'd have to be on the verge of lunacy to mow your fingers instead of the lawn. But Christopher Rowlands didn't have a choice when his runaway mower turned on him, giving him a radical manicure.
I had the previous day bought a hover mower to do an awkward bit of grass cutting around my pond. So I assembled a hover mower and could not wait to use it.
With man united with machine, Chris went in pursuit of his dream of the perfect garden. He started to mow like he had never mowed before. But as he attempted to trim the fringe around the fish pond, he lost his footing, tilting the lawnmower to a perfect position to mash his fingers, reducing his flesh to fish food. Plastics registrar Simon Huang is having a butcher's at some pictures of Chris's distorted digits.
You can just see the index finger middle phalanx is most likely split. That's not going to be very good.
Flesh and bone are a bit harder to hack through than blades of grass, but Chris's new mower has done a pretty good job of pulping two pinkies.
We know that the joints are involved, and I think that's the most sticky point here. Worst case scenario would certainly be that we have to shorten the finger to probably this level, to what we call the proximal interphalangeal joint level.
As if that wasn't enough to get his head round, after explaining everything to his patient, Simon has one final request. He wants Chris to be conscious while he figures out if he can fix his fingers.
As long as I don't have to watch you do it.
Yeah, no, we'll put a screen up, but the idea would be that I can speak to you and tell you what we find, so that you get it hot off the press.
Chris is already trying to guess the headlines.
That's me golf days over then.
I don't want to paint it too black because...
Oh, don't worry too much, I'm bloody useless.
It's not my main aim to shorten your finger or take it off or anything like that.
Just as well.
But sometimes if we know that it's not going to be a winner, I might discuss it there and then with you. Okay, Leather?
Understandably enough, Chris is not overflowing with optimism.
I honestly think that, this is my opinion, they're letting me down lightly. I think they're going to remove at least one of them.
Stay tuned to find out whether Chris's mowed mitts are about to become compost.
This is not just a simple crack of the bone, it's more of a bone explosion.
As Chris discovered, horticulturalists stand a higher than average chance of getting hurt. Put simply, private grounds are perilous, with nearly 90,000 gardeners injured annually in British backyards. Men are 5 times more likely to be injured than a lady tending to her garden. It's the sharper implements in the shed that do the most damage, with impressive numbers of injuries involving garden forks, shears, electric hedge trimmers and secateurs. Although the humble flower pot is more likely to put you in hospital, with over 5,000 annual admissions courtesy of the clay container. But the thing most likely to turn your green fingers red is the lawnmower. Over 6,500 of us fall victim to its motorised blades each year. Typical injuries are lacerations due to falls, eye damage from debris, toe amputation, or finger trauma from attempting to clean moving blades. Those with petrol mowers should avoid naked flames. In 1999, a Gloucestershire man drove a little too close to a bonfire while mowing the lawn, igniting the petrol tank and then his clothes. Desperate to douse his burning attire, he threw himself into the river running along the bottom of the garden, putting out flames, but the current swept him downstream and he was drowned. And be warned, even the most innocuous items in the garden can be deadly in the wrong hands. In Tasmania in 2007, a long-running dispute between neighbours erupted into violence. Both reached for their gnomes. But aim wasn't one man's strong point, and his garden goblin missed its intended target and struck his rival's partner smack in the middle of the forehead, fracturing her skull.
Oh, no.
He was later convicted of assault. Of course, Norfolk doesn't have a monopoly on the bizarre cases. A&E departments across Britain all have tales to tell of freak disasters that have delivered patients to their doors. One of the most hair-raising stories of recent years involved Jim Bann. He underwent an extraordinary operation after losing more than he bargained for in a horror accident at work. Factory worker Jim Bann was a child of the 60s, but while his mates dabbled in sex, drugs and rock and roll, Jim's rebellion took a different form.
When I got to be 15, 16, I thought, sod it, I'm going to grow my hair.
4 decades is a long time to have the same hairdo, but these flowing locks are this man's pride and joy.
I get called Grizzly Adams, Gandalf, ZZ Top, and it doesn't bother me.
However, 8 years ago, Mr. Band's beloved Barnet was nearly lost forever in a freakish accident that was quite literally hair-raising. Jim was operating a centre lathe, a machine that grinds down metal pipes using a phenomenally powerful rotating chuck.
Some of them have got 5,000 revolutions a minute.
When this thing gets hold of something, it doesn't let go. And unluckily for Jim, a stray thread on his sleeve was about to get caught.
As I reached over, I felt this thing grab me, my wrist. And I went, whoa. And I pulled my arm back, and it went like that, and then...
The lathe's powerful jaws had reeled Jim in like a fish, ripping the sleeves clean off his arms and burning into his flesh.
And I don't know how, but I got my head underneath.
But there was worse to come. The mechanical man-trap had now seized hold of this man's most prized possession, and to his absolute horror, the unthinkable happened.
It got my hair at the back, and just... and that was it.
Unbelievably, a flap of Jim's scalp, the size of a dinner plate, had been brutally ripped free of his skull and was now spinning round the lathe at high speed. Viewers of delicate disposition should probably look away now. Our hair fanatic had been peeled like a potato, leaving a 12-inch wide wound on his head.
And the sensation was stinging.
As Jim crawled out from under the lathe, he turned to a dumbfounded colleague and asked the crucial question.
And I said, "Has it gone?" And he said, "Yeah."
While his mates rang for an ambulance, Jim made a beeline for the bathroom mirror. Now our hair-obsessed hero beheld a baldness beyond the boundaries of his very worst nightmares.
From here, all the way around, had gone. And this bit was the last bit to be held on. Because I came out like that. It ripped this piece off, like a piece of meat.
Now his traumatised body launched itself into self-defence mode. Shock helped numb the pain, and blood vessels began to spasm and close down to stem the bleeding from his head.
And the top of my skull looked grey colour and stippled like a table tennis bat.
Seeing your own skull in close-up is pretty horrific, but for Jim, a worse terror loomed large, the thought he'd have to live the rest of his life with a bald patch.
I have never felt so humiliated or embarrassed in the rest of my life. And at that moment, I thought, I don't want to look like that.
Only one choice remained. Though half his head was hanging off and his skull lay exposed, staggeringly, Jim decided to launch a search and rescue operation.
So I just opened the door, walked out, went to the machine, found my scalp, put it on the table, sat there and just waited.
Minutes later, paramedics arrived to be greeted by one of the most bizarre call-outs they'd ever had.
It was a strange situation. If you can imagine somebody that's bald and they've just lost all the skin off the top of their head, you can see veins running across the top of the head. So I guess really it's like a hard-boiled egg with veins on.
The first priority was to dress the wound to guard against infection. Next, paramedics turned their attention to the scalp, which had to be kept in mint condition to stand any chance of being reattached.
We arranged for that to be put into a plastic bag, ready for transfer to the hospital.
On arrival at Wythenshawe Hospital, Jim was rushed into theatre, where surgeons were able to provide some insight into how on earth something as surreal as this could have happened.
In this area, it's quite firmly attached to the muscle and bone underneath, but over the upper part of the skull, there's a fairly loose layer of tissue. It does separate very easily in this plane if enough force is pulling on the hairs.
Now, medical staff intended to reunite Jim with his scalp by reconnecting the severed blood vessels.
The way that we were going to successfully replant this scalp was to connect the artery and vein again with microvascular techniques.
Replanting tissue is really just fancy plumbing under a microscope.
However, because there was a risk the detached tissue might have already started to die, it was imperative to start checking the blood vessels on the underside of the scalp. So bizarrely, Jim's hair was wheeled into theatre before he was.
Myself and one of my colleagues took the scalp to theatre and basically gave it a haircut.
Satisfied the scalp was salvageable, surgeons started on a bit of precise plumbing. And like any good workmen, when they ran out of pipe, they just dipped into the storeroom for spares.
We took a vein graft It's a tube of expendable vein from his forearm, which required a long cut to detach that vein and then use it, much like a plumber bridges a gap between two pipes.
The operation went smoothly, but a few days later, disaster struck. Jim's pipes appeared to be blocking up.
I caught a reflection in the window. Look at me, because my face looked totally different. This here was down here, this side was more or less normal. All my head was swollen.
Things looked bleak. Jim knew that if his scalp didn't take, he'd have to kiss his lustrous locks goodbye forever.
I was told in hospital that if the replantation didn't work, then that'd be it.
But just when it seemed all hope was lost, help came from an unexpected quarter, or creature. Leeches.
I thought, leeches? I know the hospital's old, but it's not that old.
But there was method to this madness, because bizarrely, leeches are commonly used in modern medicine to counteract blood clots. Doctors knew they'd attach themselves to the bloated tissue and suck the excess blood out, leaving Jim's pipes blockage-free.
All of a sudden, I could feel this thing going, like wriggling, like that. I could see the end of it, and then all of a sudden, just plop, plop, plop on the floor.
Now all that remained was to give Jim's blood vessels a final once-over in theatre, and his successful scalp replantation was complete.
And over the next few days, it all pulled itself back into shape.
This sort of reconstruction gives the patient a scalp that produces normal-looking hair. The scalp never recovers completely normal sensation, but other than that, it's not at risk from further trauma, and really he can ignore the fact that it's ever happened.
Today, Jim's hair is back to its best. Soft, long and very strong. All he's got to show for the worst bad hair day in history is a barely visible scar across his forehead.
When I look in the mirror, I can hardly see it. I think that's probably some of the best bit of needlework ever. What it is marvellous. It's unbelievable.
Being careless isn't the only way to end up hairless. Losing your locks is a common complaint with 8 million balding Brits. A typical head has 100,000 hairs. Each single strand grows for up to 6 years before its blood supply stops, ceasing its growth, and it falls out, normally to be replaced by another. About 100 strands fall out this way every day. But if your follicle becomes faulty, you could end up with a balding bonce. Going thin on top, or alopecia, takes different forms. You can suffer from patchy hair loss, complete loss of hair on the scalp, or even total hair loss from everywhere on the body. But the most common type of mop malfunction is male pattern baldness, where the hair recedes from the sides and sometimes on top. Unfortunately, fellas, it's inherited, and 2/5 of you will be showing signs by the age of 35. But ladies, it's no laughing matter. Even if you are a hairy Mary, you're still at risk of developing female pattern baldness, where the hair thins over the entire scalp. And distressing your tresses can hamper growth. Pigtails, cornrows, or even tight hair rollers can put excessive tension on the hairs, causing them to break. It's enough to make you tear your own hair out, although trichotillomania is a psychological disorder. The quest for a cure to baldness is thousands of years old. Ancient Egyptians favoured rancid hippo fat. The Greeks used pigeon droppings. Cleopatra cooked up powdered horse teeth for Julius Caesar, and Renaissance Italians favoured cow saliva. Strangely, none of these work. In fact, your best bet is disguise. Popular methods are hats, wigs, or comb-overs. Arguably, some are more successful than others. Back in Norwich, it's time for the curtain to be raised in theatre for Christopher Rowland's damaged digits. A runaway flymo has turned his fingers into flailing flesh, and surgeon Simon Huang has a battle on his hands to save them.
Okay, wow, not bad.
Chris does his best to think about other things, but before the show can get underway, there's a full-on photo shoot.
X-ray, X-ray, X-ray. Wow, nice.
No, they're not nice. They're nasty. And with the surgical snaps being far from pretty, it's not good news for Chris. It's unclear from the X-rays whether it's going to be possible to use internal surgical screws to bring the bones together. Simon needs a closer look. The bits of bone look more like shards of a shattered pint glass.
So this piece belongs to there, this piece belongs to there, so this is not possible to fix with any metalwork inside. It is quite clear that this is not, just a simple crack of the bone, it's more of a bone explosion.
None of this is sounding very good for his patient's pulped paws, but Mr. Huang has a cunning plan.
So what I'm planning to do is just putting metalwork up here and up here and keeping it and fixing it outside of your body and see how it does, okay?
After a surgical washout to reduce the risk of infection, it's time for a procedure that requires precision, poise, panache, and power tools. With Chris's finger bones smashed to smithereens, Simon decides on a bizarre solution to try to ensure their survival. Improvised scaffolding using metal pins and plastic supports.
Tough stuff.
Very strong.
Gosh.
The last metal pin penetrates his patient, and Surgeon Simon seems pleased with his work. How was it for you, Mr. Rowlands?
You've done the best you can with a bad job, really.
It's been a month since the operation, and it's the first chance Chris has had to look at his damaged digits. But he can't quite face his Frankenstein fingers. Consultant Maurice Mayer, though, is pleased with his progress.
So what we're checking for this at the moment is just to make sure that the wounds are clean and healthy, a bit swollen, but I think all is pretty well, actually. It doesn't look too bad at all, honestly. Let's have a look.
Have a quick peek.
It's best to get used to it.
You've got to look at it sometime.
I just need time. Oh, bollocks. Ruined my nail.
The physio talks Chris through some exercises to get movement back into his fingers. And our patient is almost sounding optimistic.
It's another step on the way.
Defiantly, Chris departs, preparing to return to the demon mower of digit destruction.